Good morning, good afternoon, and good evening, one and all. I'm Sunandita from Public Health Buddies, your host for the day. I welcome you all to our live session in lieu of World Immunization Week 2022. At the outset, I take an opportunity to introduce you to Public Health Buddies, an awareness initiative by budding public health professionals and students from various parts of the world. It is an interactive knowledge sharing platform run on various social media streams with a vision of demystifying public health concepts. Our objectives are twofold. The first is to spread awareness about public health issues amongst general public and get everybody to talk about those. The second is to promote cross learning within the public health community, utilizing the rich experiences of stalwarts of public health from their field experiences. Here we conduct live sessions with public health experts, and therefore our team at Public Health Buddies takes pride in diverse range of its audience, including professionals from the field of public health as well as non-health backgrounds belonging to different geographies of the globe. On behalf of Public Health Buddies, I extend a warm welcome to all of you. I now request Anjali to extend a formal welcome to all of you and introduce you to our guest for today, Dr. Snehil. Anjali, over to you.
Thank you, Sunanta. Distinguished delegates, participants, and partakers. It is a glorious moment to extend my warm wishes on behalf of Public Health Buddies. I want to convey my heartfelt gratitude to each one of you for accepting the invitation for this webinar on making immunization cold chain system resilient. Learnings from COVID-19 with Dr. Snehil Kumar Singh, an immunization cold chain expert. Our distinguished guest, Dr. Snehil, has an experience of more than 14 years at national and subnational standings. Holding a comprehensive background in multiple domains of public health, he has delivered in areas such as COVID-19, vaccination management, immunization, new vaccine introduction, VPD surveillance, team and project administration, supply cold chain, program advocacy, liaison with partner and government, and program implementation and research. Currently working as a national state support lead with John Snow Incorporation for the USAID project MRIGHT, he leads a team of 80 professionals in 18 states of India in order to strengthen COVID-19 vaccination in the country. He has worked with organizations of repute such as World Health Organization, John Snow Incorporation, UNICEF, National Institute of Health and Family Welfare, etc., through numerous healthcare programs. It is an opportune moment to refurbish and talk about the problems faced in cold chain management, especially during the pandemic. The existing cold chain systems found themselves overwhelmed by the pressure of storing and transporting the vaccines against COVID-19 while maintaining vaccines for routine immunizations. On behalf of Public Health Buddies, I also welcome the teachers, practitioners, preachers of public health from Indian Institute of Public Health and the University of Leeds, as well as all the seniors who have graced this occasion with their valuable presence. Before diving into the conversation, let's demystify the importance of and challenges of the vaccine cold chain management systems to you through a short introductory video of the event.
Ever wondered how vaccines reach the remotest of villages from the point of manufacturing? It takes a complex logistical process called cold chain, a chain of precisely coordinated events in temperature controlled environments to store, manage, and transport these life saving products. But what is the need for controlled temperature? Vaccines must be stored at a specific temperature from the time they are manufactured until they reach the beneficiaries. Beyond the specific temperature range, vaccines tend to lose their ability to protect against the disease, which cannot be regained or restored once lost. The vaccines are packaged in a glass or plastic vials and transported from the manufacturing units via road or by air to a national storage facility. Here, they are stored in cold rooms before being distributed to regional and sub-regional stores, from where they are disbursed to community and primary healthcare centers. From the health centers, the vaccines are then carried to their field for outreach vaccination. The transporting vehicles, such as trucks, are refrigerated or insulated with temperature regulators. And for the air cargo and outreach vaccinations, the vaccines are placed in boxes that contains ice packs or dry ice. At the health centers, the vaccines are usually stored in ice-lined refrigerators or deep freezers. Disruption of the cold chain at any step shall lead to the vaccine being ineffective. Now comes the antagonist of our story, COVID-19. Leaving no health system component untouched, it overwhelmed the immunization systems as well, especially the cold chain systems. But public health professionals, always the protagonists of our stories, fighting all odds, just managed to deliver you the COVID-19 vaccines along with the regular ones. What is the story behind fighting those odds? What were the struggles of cold chain systems? And are they resilient enough to handle future emergencies? Let's hear the tale from the horse's mouth. Dr. Snehil, an immunization cold chain management expert, demystifies these questions for us. Join us this Saturday, April 30th at 4 p.m. Indian Standard Time and 11:30 a.m. British Summer Time to know more. See you then.
Thank you so much, Anjali, for this introduction. Um, Now that we have established our ground zero, let's invite Dr. Snehil to the mic for initiating the discussion. I welcome you, sir.
Thank you, Dr. Sunita and Dr. Anjali and all of the team members of the buddies, public health buddies. So thanks for creating this platform and inviting me for this conversation. So looking forward to a very fruitful conversation ahead.
Thank you so much, sir. It's a pleasure to have you indeed. And before I delve into the question answer session, this is for our audience. Just as a housekeeping check, in case there are any questions that you all feel that Dr. Snail needs to address during our conversation, we request you to kindly post them in our chat box. Our team shall compile those and take the questions at the tail end of the session. Thank you, everyone. So, sir, without further ado, let's commence with the first question.
Okay.
Considering your active association with the immunization cold chain management, what we'd like to know first is that what were the challenges faced by the vaccine cold chain with the advent of pandemic and how they were mitigated, especially in India?
So, Dr. Sunita, COVID-19 pandemic, we all know that brought toll for almost all of the sectors, including health and immunization cold chain also. So, if we'll talk about Universal Health Immunization Program, that is UIP in India, where we have already established immunization program. So, we are already, the country is already dealing with 26 million of cohort of 2 years of age group of children. So, again, that's a huge number, and country was having adequate space for this cohort. But as pandemic came into the picture, the whole population of country was susceptible for this COVID-19 disease. It means that the immunization was necessary for this whole population. So in the beginning of 2020 only, it was already proven that vaccine is the most effective tool to limit this disease. The vaccine was supposed to be introduced by the end of 2020, and we were left with very, very less time in hand to prepare for this pandemic and to overcome certain challenges like ensuring adequate cold chain space. This was the one of the biggest cold chain concern at that time when people, experts along with the government of India started thinking that how to manage the vaccine into the system until we don't have cold chain space. Apart from another thing was to strengthen the health system, because if you see at that time, if you can recall, the lot of vaccines were being manufactured with different vaccine temperature, storage temperature requirement. Like, for example, Covishield and Covaxin is recommended to store at 2 to 8 degrees centigrade. At the same place, Moderna and Pfizer, there are certain vaccines which are supposed to be stored at ultra cold chain point or ultra cold chain storage point, that is -70. So So it was a big challenge to understand that we nobody was sure that what we are, which vaccine we are going to have in our country, and these were the very major issues to strengthen the health system to have these vaccines. However, later on, the major vaccine, which are the Covishield and Covaxin, which were introduced into our system, were basically 2 to 8 degrees centigrade requirement only. Apart from that, the increasing the capacity of health staff on SAPs of newer vaccines, because again, we were not having much time in our hand. So it was very important. It's not about only having infrastructure, rather it's all about the how we can use those infrastructure. Is completely useless. And the most important thing, the data management, ensuring a reporting mechanism for these vaccines to run this system. So these were the certain major challenges in terms of cold chain at that time, for which we were getting ready. The system was getting ready. So at the outset, all of the above challenges were mapped. That was the best thing. Or you can say that India has a good history of immunization. We have conducted many campaigns like polio and MR. So India was having good experience of having the big level, or you can say the huge, the biggest immunization. All in past also we have conducted the biggest immunization program in a campaign mode like MR. So on the basis of those experiences, India tried to map all of the, you can say, these issues, and the team started working. So under the guidance, or you can say umbrella of the government of India, uh, a team was created. There were many like committees were created, starting from NEGWE. But for cold chain also, there was a team where all of these immunization partners were brought on a board, and we started looking towards challenges that how to deal with. So on cold chain storage part, which was one of the biggest issue, I would like to tell that it was planned in a two manner. First was to utilize existing resource because we were already having few certain system, and another was to add more equipment into the system as per the need. So for utilizing existing resource, the long scale, a high scale, the preventive and maintenance campaign was run at that time, and all of the equipments which were not working, maybe kept on in buffer stock or maybe not working, all those equipments were repaired for to use it for the to make that those equipments to be able to be performed for the COVID-19 vaccine. So that was one thing. Apart from that, the best part with India, I would like to tell you that India is a huge country. At that time, for UIP, we were having more than 100,000 of electrical cold chain equipment, which is a huge number, but that was not adequate at that time. But anyhow, the best part with this country is this, that we were already having a MIS system, that is the National Cold Chain Management Information System, where the historical data was placed. So on the basis of that, first we tried to see that where we have extra stock, where we have lesser stock. So we tried to redistribute those equipment. That was the second step. At the same time, procurement process was started. So before starting the procurement process, a CoviCal, a calculation tool was developed by government, I mean, along with all of the partners, where if once you'll put the input data in terms of the what is your current requirement, what is your total space available. So on the basis of that, that could tell us that how many equipment we needed more for COVID-19. And that too was not very easy because you could not target the whole cohort of the country to cover, because India is having a very huge country. We looked into our capacity of conduct the session, as well as the vaccine manufacturing capacity was also referred, that at what flow we'll be receiving the vaccine. So all these things, jointly helped us to prepare assumption to come up with the assumptions, so that we can prepare a plan, or we can map the number of equipment required for the COVID-19 vaccines. One extra thing was done, which was the uh, short supplies was prepared. The country enhances, or you can say strengthen the vaccine supply system, so that we can distribute vaccine in a very quick manner, so that if a state or maybe if a district is having a storage capacity of 1 month, so we can replace their stock in next 1 month. So these were few interventions which were utilized at that time to overcome the situation. One very important thing at that time for backup, we also mapped the private cold chain sector. That was a bit innovative, and through which we try to, have to prepare to be ready with the backup. If we will not be able to manage through our own equipments, we can collaborate with the private sector. But fortunately, that was not required at that time. India could manage through its own infrastructure or inbuilt system. A few more things I can recall, that a lot of collaboration was done with PSUs, so that for the vaccine cold chain equipment distribution. So there, government of India took a lead, or here you can say that government ownership, and they involved many PSUs who contributed in the equipment procurement. So there were two things. At one hand, India was procuring equipment at a very fast manner, but just to fill the gap, we also took equipment from the PSUs. So all these things jointly could help country to overcome this concern. And now I can proudly say that the cold chain space was never a concern for country.
That's
And
indeed.
again, few more things I would like to say, that was the cold chain space part. On training component, again, we were not knowing that what is going to be happening. Generally, it takes 1 year to prepare a SOP. So for training, again, between the experts, all of the components were distributed as per their expertise. Like UNDP was looking into the cold chain component, maybe UNICEF was looking into the communication component. So, and WHO was looking into the monitoring and other components. So in a rapid and jointly manner, training material was prepared, and one cost online cascade training was rolled out to increase the capacity of HR. So these were the few things, Dr. Sunan.
That's really insightful, sir. And I think, as you rightly said, it's not just about the infrastructure, presence of infrastructure. It's also about utilizing those resources well. So, I think it's like the leadership component of our health system presented a very good picture for, I think, cold chain management. Indeed, very insightful for us, sir. So, moving on, sir, like we just discussed about our challenges during the COVID, and referring to the unprecedented times of the pandemic, we are currently also facing certain global concerns. For instance, the like the war, that is the unfortunate war situation that is happening in Ukraine right now. So what I want to know from you is that how important is immunization in an emergency crisis situation like war, and how do we deal with the supply chain challenges in such scenarios?
That's a very relevant question, Dr. Sunita. It's a very common condition in many countries, including Ukraine, if you'll see. So the population going through war crisis lives in the crowded conditions. It increases the migration. People lives into the urban settlements, maybe reception centers, camps, or immigration detentions, where infectious disease can spread more easily. Because you know that if you'll be living in a poor hygienic condition, the infectious disease can increase very fast, and it
Yes.
makes the immunization more important for to protect the particular community, that vulnerable community, against many infectious disease. Also, one barrier occurs about the documentation, because the people generally don't carry their ID cards, registration, or any civil documentation. So that also creates a problem here. So this makes actually immunization very important. Certain challenges, like in this scenario, just to highlight more, it creates high level uncertainty in target population. You don't know that how many number of people at a particular place where they will be next day, because they keep moving. And then it makes difficult the planning of the immunization session. You don't know that how many number of doses you need to send in a particular place. Also, there used to be disrupted flow of budget, lack of capacity temperature monitoring, because we all generally lack with the HR also, hiring of the HR, or maybe it used to be difficult to retention of the HR in such scenario, because there used to be many destruction into the infrastructure in such conditions, like disruption in the electricity supply. So these challenges creates more problem for the vaccine management, including, if you'll see, the generally what happened, the security things used to be very high in such scenario.
Right.
So for example, vaccine is supposed to be transferred from one country to that particular country, so it takes a lot of time, even between two districts. It takes a lot of time through security process.
Right.
So that's why it makes it more difficult. So for to overcome this concern, because we cannot avoid anyhow the vaccination for this community, we can work into the three manners, rather interventions to improve availability of the vaccine. For that, we go for the shock proof cold boxes for helicopter drop. Maybe sometime you cannot reach to that place, but you can drop the vaccine through these boxes. uh, Also, we can club our supply with other convoy supplies. For example, if the food or maybe some similar product is being supplied to that place, it could be clubbed with that. And then engagement with community leaders. So in such scenarios, a lot of community leaders, used to come in front to help the community. So it's very important to have a good coordination, because you need to you are supposed to move from one place to another, and there used to be different community leaders at different places. So that engagement is very important. They may be utilized as a strength. Another one is to improve the vaccine potency. For that, is very important to have a forecasting tool. Until unless you don't know that how many people are there, that will completely impact your vaccine potency. Also, building resilient health system. You need to be ready beforehand to fight such scenario, or maybe having a solar freezes. In work crisis country, it's very common to have, disrupted electricity supply. But if you have solar freezes already in your country, maybe you can overcome that concern. So these are the few issues. There is one more solution, that is improving efficiency. Here you can collaborate with the private sector and NGOs to act or to function as extra delivery or supply chain point. So it will decrease your burden on your system of transportation. You can transfer more vaccine to that particular place. You can ask your people to have that vaccine at those NGOs or private sector cold chain points. So these are the few solutions to overcome this concern.
Right, sir. Right, like you said that it's important that the public, private, and voluntary sector also right partnership in such times of crisis indeed shall play a great role. Thank you, sir. So, moving on to the next question. Talking about today's theme, I request you to throw some light on what we call a resilient immunization cold chain system. So, I'd like to know from you that what actually is, in definition for you, an ideal resilient immunization cold chain system, and what is the relevance of such system, and how do we actually ensure that we have a resilient immunization cold chain system, sir?
So that's a very important question, Dr. Surendra, and I must say that since pandemic is here, we are going through pandemic. Lots of conversation has been started on, making system resilient. In all of the sector now, we are talking about resilience, including cold chain or maybe immunization. So let's understand what is resilience. Resilience, simply in a simple language, if I'll tell you, to be able to make your system enabled to overcome such uh, emergency situation. For example, we had COVID-19 pandemic. Obviously, we were supposed to have more cold chain space. So it's all about that, to be ready beforehand, so that we can sustain with the challenges without impacting much extra resources into the system, because you cannot keep investing always, right? Like, okay, we need two equipment for routine immunization, but facing this pandemic, we had to have six equipment. That would be like investing a lot. So that's why, for working on resilience, we need to have an integrated system with other departments. So let's have a bit more. I would like to throw a bit more light on resilience. So what is resilience system exactly into the health? So it used to be into two types. One is the intrinsic, another one is the extrinsic. Intrinsic means that, so there could be many kind of resilient challenge or issues for resilience or situation for resilience. In intrinsic part, maybe you are lacking, there is electricity breakup, or maybe you are lacking with the HR, you don't have enough cold chain space. That is intrinsic challenge. So pandemic is also an intrinsic challenge, and sometimes there is to be extrinsic challenges, like any climatic issue. You have a earthquake in your area, or maybe some political disturbance in your that particular part. That is extrinsic part. So this COVID-19 pandemic is one component of intrinsic issue, intrinsic resilience. For COVID-19, what I could learn from my experience is that integration is the best solution. For example, when we were working with the private sector, mapping out the private sector, we realized that there is a huge place. They have a lot of cold chain space with them, which may be utilized whenever will be needed. So, but they were concerned you cannot simply keep your vaccine into a private sector cold chain point. You have to invest in them in terms of increasing their capacity. So for COVID-19 pandemic, I must say that is one thing. Having integration with the similar commodity suppliers or cold chain suppliers, maybe other government departments like agriculture department, or maybe other health commodities like blood banks, the departments which are having cold chain space, and then uh, increasing the capacity of their HR or strengthening their system so that if required, they can keep our vaccine. In the same manner, we can help them also if they are going through some emergency. So integration is the key. Apart from that, as I just told, having solar equipment, because if you are having solar equipment, you are making your system or your equipment independent at certain extent. So these are the few things through which you can fight COVID-19 like scenario.
Right, sir. Got it. Integration, you said, is the key. So
Integration.
takeaways are important equally. Okay. Sir, if I may request, we have in our audience Dr. Lokesh. I think.
Thank you very much. Hi, Dr.
Hello.
Snehil.
Hello, Dr. Lokesh. Welcome on board, sir. Thank you for
Thank you very much.
So, sir, since we have an opportunity of having you in the audience as well, I would like to introduce the rest of our audience members that Dr. Lokesh is from UNICEF Malawi. He has a diverse public health experience for nearly 14 years, and he's worked extensively in India as well as Malawi in the field of immunization. So, sir, may I request you to kindly give us your perspective of how cold chain challenges are mitigated, especially in countries of Africa, sir.
Thank you very much for the question, and great to hear Dr. Snehil and his wisdom in the area of immunization supply chain. So, if I talk about specifically for African region, so most of African countries are in either low and middle income countries or are in poor countries. So the challenges which we foresee in India, so in comparison to India, the challenges in Africa are totally different. Let me start with the very basic things, like the first challenge which we have in country like Malawi or in African region. So there are more hard to reach areas in comparison to other countries. So for giving you an example from Malawi, 95% of the health facilities are considered as hard to reach facilities. So you can understand the different challenges in terms of geographies. The another challenge, if we discuss about, so we have a very poor infrastructure in terms of physical infrastructure. So the buildings or the health facilities where we generally establish cold chain points, so the infrastructure is not up to the mark. So there is a lot of requirement to invest in the infrastructure. The third area of concern in the African region is availability of electricity. So giving you an example from Malawi, only 11% households are having electricity. And most of our health facility does not have electricity. And because of that, as mentioned by Dr. Snehil also, we are going with the solar cold chain equipment. So we are demanding more cold chain equipment from solar so that we can ensure that the functional cold chain is always available for vaccines. The another area of concern is like the technological interventions. in African region, still people are using those basic phones, like those keypad phones, and there is very poor internet coverage, lower than the district level. So if we would like to introduce anything, particularly in terms of using internet or using technology, then we will be facing a lot of challenge in collecting the data sets and in collecting to information from lower health facilities. So for preparing or for introducing any technological intervention in the country, that is another area of concern. In terms of mitigation of cold chain during the COVID-19 vaccine introduction, there were certain activities which were carried out in different countries, like the for cold chain space assessment, we need a proper database of different cold chain equipment. So availability of database having different inventories of cold chain was a challenge, but the based on the available data sets, the proper cold chain assessment was conducted, and a proper plan was prepared. We also got funding and donation from different donors like COVAX and UNICEF. They supported in getting the cold chain equipment to augment the cold chain capacity in the country. Then we also got some donation from government like government of Japan and some other countries. They supported us to procure some cold chain equipment, and we ensured that sufficient space is available to introduce the COVID-19 vaccine in the system. So these are few of the experiences and few of the challenges which we encountered in the Africa region. And yeah, this is over from my side. Thank you.
Thank you so much, sir. I think we have a few of our participants participating from Africa itself, and your insights and your experiences shall add value to our knowledge. Thank you, Lokesh, sir.
Thank you.
Thank you, Lokesh.
So, sir, Snehil, sir, coming back to you, uh, I want to know another fact is that now that heat stable vaccines as well as micropatches are being developed and are becoming available, how do you imagine immunization cold chain systems in future? And what to do with the investment done on cold chain if such kind of innovations are in the pipeline? And what do we do with those systems developed?
So that's very interesting to talk, Dr. Sunita. So that's true that now heat stable vaccines are available. Am I audible, Dr. Sunita?
Yes, sir, very
Yeah,
much.
that's great. So heat stable vaccines are available. Even in India, we have rotacil vaccine that is for the rotavirus diarrhea, which may be kept at room temperature for over a period of 6 months. So it's kind of, I mean, there's no requirement of cold chain. Though Government of India is still just to maintain the uniformity, keeping that vaccine into the cold chain system. Maybe in future there will not be requirement of electrical cold chain equipment, but it would be too early to take any call or to think about that. It will take years to have all vaccines. We have many vaccines here into the system, and it will take years to have all vaccines as heat stable. But very good question, interesting point. We can start working to create a visionary document on reshaping of immunization cold chain. This is the time when we need to think. And on the investment part, I must say that we need to integrate with other health commodities like blood bank supply, or maybe other health commodities for which we need to, there is a requirement of cold chain like HIV testing kit. So maybe this integration initiated at that time. So if there will be no requirement of cold chain for immunization, or maybe there will be extra space into the cold chain, that is space will be utilized for other health commodities, and it will not be wasted. So it's like that. So we can work on some kind of visionary document at
Right,
this
sir.
point of time.
It's a good time, like you said, to
Yeah,
begin
it's a good time. It's a good
thinking.
time to think about that, how to, because in micropatches also we don't need uh, cold chain, and that too, a lot of interventions, innovations are going on to have multi vaccines in a single vial, just like pentavalent,
Right. Pentavalent,
tetra.
right.
So there are many vaccines already. There are many vaccines. Maybe in future, very few shots will be given to the children or to beneficiaries. So that could be done.
Right, sir. Right, sir. Right. So, moving on, sir, we are talking about refrigeration in the cold chain systems, and while the entire world is talking about climate change, so what in your opinion would be the impact of the refrigerants of electric cold chain equipment on the ozone layer, and how does it align with the climate change, sir?
So, Dr. Sunanta, it's very crucial to take care of environment because it's for all of us. It's everywhere, and without a healthy environment, everything is useless. In the front of cold chain, I must say that initially years back, or you can say decades back, we were using a kind of equipment which were CFC driven, chlorofluorocarbon driven, and
Yes.
which were and the ozone depletion potential for that particular refrigerant was too high, and they were harming the ozone layer. So on the same track, there was a Montreal Protocol. It was an international agreement which was made in 1987, and it was decided, or you can say it was designed to stop the production and import of ozone depleting substances like that CFC gas, which can reduce their concentration into the atmosphere. So on the
Yes.
same track, by 90, it was decided to remove all CFC equipment by 95. So it was removed by, I think, if I can recall, by 97, all of the CFC equipments were removed. And then we started using more high tech and less harmful refrigerants. But those refrigerants also were causing, harm at certain extent at limited level to environment. Recently, natural hydrocarbon refrigerants are being used for equipment which are natural, non-toxic refrigerants, and that have no ozone depleting properties. So that is one good thing, and it also doesn't cause low global warming potentials. So I must say that nowadays, whatever equipment is being approved by WHO PQS or being procured by the government as well as private players are not harmful to the ozone layer, and we are in good condition.
Right, sir. That's I'm happy to know that about this development. And sir, now moving on to the last question, we've this year the theme of World Immunization Week is long life for all, basically focusing on equitable vaccine equity, right? So, equitable coverage is one of the bigger concerns for immunization. So, could you please throw some light as to how do we ensure vaccine delivery at the last mile, especially in hard to reach areas?
Yes. So if you can recall, or if you have read somewhere, according to WHO UNICEF estimate, which was published, I believe last year in July around, and as per that data, approximately 23 million children worldwide alone were left unvaccinated that year in 2020. They missed their basic vaccination, and that number was biggest since 2009. And if you compare with 19, around 3.7 million were left for their basic vaccination. So obviously COVID-19 also itself causes a lot of disruption to immunization program during those years. And in spite having good coverage in many countries in different parts of the world, there are still certain pockets where the coverage is not that adequate. Or you can say we need to increase the service delivery in those areas. So and especially in the conflict affected areas or underserved areas or remote far-flung slums. So it's a very, very important point, or maybe very important agenda for all of the health professionals. Uh, on cold chain component, I must say that cold chain plays a vital role in ensuring vaccine coverage with coverage with potent vaccine in such areas, because if these people are living basically in hard to reach areas, and vaccine needs regular temperature of required temperature, or you can say suggested temperature. So the cold chain plays a very crucial role. For that, we can do few things like we can work on increasing network of cold chain points to ensure time to care approach. So as per time to care approach, we have a cold chain point at a place from where we can ensure the vaccine delivery to farthest out station within a 60 minutes. So that will really help. The increasing network of cold chain points will really help to, ensure the vaccine availability in such areas. And as I told, that installing solar equipment. So on these cold chain points, if you can have solar equipment, it will decrease the dependency on electricity and will be able to ensure the vaccine availability. Also, there are many equipments are coming up with combination where there used to be a small component of deep freezer and a small component of ILR, means 2 to 8 degrees centigrade cabinet and minus 15 to minus 20-degree centigrade cabinet. So if you see in these far-flung areas, we don't need much number of vaccines. So having these kind of equipment can help us to ensuring vaccine delivery. We also need to work on alternate vaccine delivery, means alternate vaccine delivery is a third party mechanism through which vaccine used to be supplied to the outreach station on a payment basis. So that increases the community involvement in the program, as well as also ensure the availability. Installing remote temperature loggers in these equipment, because we cannot ensure the monitoring at regular basis. So that remote temperature loggers, which can tell us sitting at district headquarters that temperature is maintained or not, ensures the supportive supervision of that particular cold chain point. Using newer technologies, like I must say that Architect is a equipment which was I think invented last few years back, which can give it's a passive container and without electricity driven container, and it has a good volume also for the vaccine storage, and it works without and it gives the temperature range. It ensures the temperature range, required temperature range for 30 days. So that also could be kept at remotest areas. Recently, I heard about Black Frog technology, which is a battery operated and chargeable equipment, which provides the temperature range. It has a monitor. I'm just going in detail, I think. So having these kind of equipment, grade A ILR equipment, can again help us to, back in a vaccine delivery. And in recent time, you must have heard about vaccine delivery through drone. So that is one innovative idea which can be utilized to ensure to drop the vaccine in a particular or remote areas. And the most important thing, ensuring supportive supervision, capacity building of the HR, because how to manage the vaccine at that level, or how to ensure supportive supervision. So these are the few things through which you can ensure cold chain component, especially in hard to reach areas, because once you'll be able to make vaccines available in remote areas, then only we can deliver.
Right, sir. Very right. So innovation along with the support and capacity building, I think, are the answer to equity in vaccines. So thank you so much, sir. With this, we come to an end of our discussion. And we are really thankful to you for taking us through the challenges of cold chain management, and also highlighting that how public health as a science and we as professionals need to think holistically, and how we are vested with that responsibility of thinking about all the integration, partnerships, and everything, bringing all that together, innovation together, in order to deliver our tasks. And thank you so much for making this discussion frugal in words, but fathomless in meaning. And thanks a ton, sir. So please go
No,
ahead.
thank you so much for inviting me. It was a very, I think we have few questions also in chat box, if we can
Yes,
have
sir.
those questions.
So, sir, before we open the floor for audience questions, may I request Dr. Himanshu Negandhi to kindly express his views about today's session and today's topic. Dr. Himanshu is a project director and associate professor of epidemiology at the Indian Institute of Public Health, Delhi. And most importantly, he has been our inspiration and our guiding light as well. Himanshu, sir.
Thank you, Sunandita, for the kind words. But at the outset, let me express my gratitude to Dr. Snehil for such an insightful session, and the discussions and the response to the questions that he has provided will be very helpful to every single young public health professional who has joined this session. I will just keep my comments very brief to 60 seconds, but I would like to highlight three issues. As I understand, a lot of you who are joining this session are young public health professionals. And although it might sound very cliched, but let me point out that working in the immunization sector is so important to develop crucial public health skills, such as, let's say, skills in needs assessment, undertaking planning for organizing a session, mobilizing a community, the actual implementation and delivery of the vaccine, trainings, injection safety, managing supply chains, making sure that all the intervention that you provide, you monitor them for adverse effects, keep good records, and very importantly, intersectoral collaboration. These skills are critical for any public health job, and working in the immunization sector really gives you a grasp on these issues. That's the first point. The second point, which Dr. Snehil also referred to, is that India has been fortunate that we have a well-developed universal immunization program. It's actually a legacy of smallpox vaccination, which was started in the 70s, that we have an adequate human resource which could be scaled up, could be repurposed and diverted for COVID-19 vaccine. So it was these transferable skills that our people had, which could be utilized for this purpose. The last and the third point which I would like to make is that public health resides on, there are three legs to a tripod. Let me put it across this way. The first is that we need clear policy direction. The second is that we need reliance on science. We need contributions from science. And the third is that we need full-fledged participation from communities, from the health system, and from the partner agencies as well. And the COVID-19 experience has shown that when the three legs of the tripod are well structured, supported, and present, we surely can make a great dent by using public health means and improve the health of our countrymen. So it was lovely listening to you, Dr. Snehil. It is a great initiative by public health buddies, and hats off to all of you for deciding to choose a career in public health. Thank you very much.
Thank you, Dr. Himanshu. It was actually insightful to listen to you.
Thank you, Snehil. The pleasure was equally mine. Thank you.
Same.
Thank you so much, sir. Thanks a lot. So now I think it's time to open the floor for questions from the audience. I request Parinita to kindly take over and preside over. Yeah.
Am I audible?
Completely.
I hope yeah,
You are.
okay. Thank you. Yeah, thank you, Sanandita. So I shall be taking ahead from here. We have a few questions from the audience. The first one being from Dhananjay Srivastava. He wants to know, you have suggested so many interventions for the strengthening cold chain and supply chain. How to strengthen community engagement and partnership for a resilient cold chain? Do you think community monitoring can help? This is the first question we have right now.
Yeah, exactly. So thanks, Dr. Dhananjay, for he's a very experienced professional, and thanks for raising this point. So this is a very important component these days, which are being discussed into the health policy during the health policy creation. That where we are able to involve the community into our program management or into the policy generation. So the first point is absolutely right. What he told, that we can involve the community into the monitoring and supervision component. So we can form the a committee at different levels where we can have their inputs, their suggestions, and also we can involve them. So we have to increase their understanding about the program first, so that they can understand, okay, we have all those things, we need to have these things at a place, and then we can make them part of the decision making, not directly, but maybe as in a suggestive manner. So it will increase the accountability into the community, as well as it will it will increase the trust in community about the program. So if you'll see, I am working with immunization program since years, since long, and I have taken all of the vaccine for my children through government sector. from government sector. So why? Because I know the system. We have VVM at vaccine in all of the vaccine of the government system. In private system, it was not there. Nowadays, few of the vaccines are coming up with VVM. Then again, the monitoring supervision part, there are many independent monitors who look keeps who keep looking into this process. So if our community are being engaged into the system, they will be understanding, trust will increase, and we'll be able to fight the trust related concern more if we are going to get them engaged. So absolutely right, in community engagement is I must say that that's the very important key to have a more reach into the community for our vaccine.
Thank you so much, sir. And the next question is from Apurva Bharadwaj. She wants to know, like, if in a country which the countries which have lack of infrastructure have electricity issues, how do we solve? Like, what are the solutions for ensuring immunization in those countries?
Yes, so that's a big concern because nowadays what happened long back, wherever infrastructure was not there, a lot of parallel system was created to overcome that concern. Later on, we learned that in a manner we are paralyzing the system, and that's not very good. So now we are focusing more on health system strengthening. We means all of the public health professionals, including government, is more focused on health system strengthen. So on the same manner, I think when we are hearing from Lokesh, and Malawi is a country where we do not have much. Adequate infrastructure. They have their own priorities. So in such countries, we need to, we have to focus more on health system strengthening, or maybe if we are investing. So first priority should be to have the coverage. So having mobile vans reaching to the community, connecting community to the health system could be one tool. And at the same time, we have to keep regularly working on, enhancing the health system, the country's own health system capacity, so that once the system will be taken out, the support will be taken out, they will be able to work on. As far as the infrastructure, lack of infrastructure is concerned, we have to work on the prioritization, like what is the priority and how we can connect. So in cold chain, it's very important to have good infrastructure in terms of cold chain. So if you know that there is a mechanism of CTC, there is a vaccine management system, controlled temperature change, where you do not need equipment. And for that, obviously, we need to have WHO qualified vaccines also. So maybe that could be implemented if we are going for a certain campaign. If we have the CTC approved vaccine, the vaccine under CTC, the vaccine may be transported at below 40 degrees centigrade, or within the ice cold boxes without ice packs for a certain days. So these kind of interventions we have to bring into the picture, and we have to convince government to invest, or you can say the last thing I would like to add, we have to come up with the comprehensive health packages. For example, if we are going into a health in an outreach area for immunization only, it will cost a lot. But if we are going with 4 5 services, maybe ANC, maybe nutrition program, so it will decrease the cost burden, as well as integration, as it was rightly mentioned by Dr. Himanshu. So maybe we are just for example, we are in India, we have a cold chain system for immunization. We have a different cold chain system for the blood bank. We have different cold chain system for the agricultural products. So it's difficult and not very easy, but proper supportive supervision and monitoring, as well as training, we can ensure the integration, and that could be one tool, so that with limited infrastructure, we'll be able to achieve our objective.
Thank you so much, sir, for bringing out such important points. The next question is from Yashasvi. She wants to know, in case of integration with private sector, will it solve the cold chain management problems of states where private sector is not very existent, for example, Madhya Pradesh, Bihar, etc.?
So let me tell you, there are private cold chain sectors. There are many private cold chain sectors. There are, I recently, right now, I am not able to recall, but I means the team has mapped long for COVID-19, and we were having huge space in almost all of the states. So question is this is not this that there are private sector or not. The question should be, or the major question is, they're increasing their capacity, bringing them at our SOPs. And second thing, convincing them for the collaboration. What would be their benefit apart from money? So for that, we discuss with them that, okay, we will keep enhancing your capacity, your team's capacity regularly on the government SOPs for vaccine, as well as we can give them some recognition, like maybe if they are qualifying, they could be given the certification, which will be very valuable for them, as well as the training certificates also may be very valuable for them. So these kind of things could be done to motivate them for the collaboration. I think these two things could be done. And
Thank you,
and
sir.
and considering this question, if you think that there is no private sector, you can look for other government cold chain community department. As I told, agriculture, there are many if you explore. So they all maybe tap. There are many labs which are having cold chain spaces in bits and pieces. So that also could be tapped. So it's all about mapping of similar resources.
Thank you, sir. Thank you so much. Another question is from Dr. Rishabh. He says, kindly enlighten us regarding how to improve immunization coverage in urban population and cold chain management.
In urban population, what happens that due to dense, the mapping is very poor. That is the major concern. In urban, we don't know that. I mean, so if you see the NFHS data, there are two kind of scenario. The coverage is good into the uh, good income community, but the coverage is very poor into migratory population or low socioeconomic group. So that is one concern. For that, mapping migration is a big concern. We don't know, and then again, including peri-urban area, it's increasing problem more to the system. So these are the few concerns. So mapping them, involving other municipal corporation, other departments into the urban areas, other health sectors, other like malaria department, and because the best part with urban is that everybody is residing at a place. They used to live very, the departments are very close, so it's very easy to have a collaboration. In terms of cold chain, actually what happens in India, we had a concept that there should be one cold chain point in one block, and then again at PSCs. In urban, generally what happened in was happening in past, that there used to be district vaccine store, and vaccine was being distributed to all of the urban areas in the city from that place only. But now government is working to decentralize this urban cold chain points, and that is the tool. We have to decentralize the cold chain points, as well as we have to work on the AVD. So these are the two major tools to ensure the vaccine delivery. Decentralize, creating more cold chain points, as well as strengthening alternate vaccine delivery system.
Okay, another question. So since we are running out of time and we have so many questions still left in the chat box to address, so should we send these questions to you through mail, or can we take it right now only? I mean, as you say.
So I'm available if people are not getting bored, so we can discuss.
Yeah, okay, fine. So the next question is from Dr. Vishak Saraf. His question is, the entire logistics of cold chain is a complex process. Are there any novel ideas that can be introduced to ensure the best practices and highest quality assurance, especially as we move to block level? How can private players such as CSR and NGOs help here?
Second part I got, actually. First part if you can repeat.
Yeah, sure. Just a minute. So he wants to know, the entire logistics of cold chain is a complex process. Are there any novel ideas that can be introduced to ensure the best practices and highest quality assurance, especially as we move to block level? Then he asks, how can private players such as CSR and NGOs help in this context?
So there are a lot of things, include if you are talking about block level, I'm considering you are talking about far from the district headquarter. So we can involve NGOs and other. So to improve the logistics supply system more in a country like India, we can introduce many innovative technologies. Like nowadays we have freeze tags, which may be introduced into the system, which ensures, which tells us about the the temperature of the vaccine carrier now, or maybe we can have refrigerated van. In India, generally we have insulated vaccine van. So it could be replaced with the refrigerated vaccine van. Then again, the data management system could be worked. Fortunately, India has a very famous and or revolutionary technology, which is EVIN, through which we are managing the temperature. We are able to see the temperature of the vaccine sitting at the district and state headquarters, as well as stock also. So having this kind of system, having newer equipment into the process can really help into the in the enhancement of the vaccine supply. On the second part, CSR and so AVD is an opportunity, and one of the intent of AVD, alternate vaccine delivery, was to involve community into the system. So as per AVD, no government people can pick the vaccine carrier from last cold chain point and supply to the outreach station. As per AVD, someone from outside will pick that vaccine carrier, and he'll be paid. There is a fund into the PIP. So that is one of the very important bucket where we can involve community or maybe NGOs if they want to be associated, uh, and also in different committees. So nowadays government is forming many committees where these people are being involved. These people are like Gram Pradhan or maybe community leaders and people who are interested, the educated people. So they are being the part of the decision making, what should be done and what should not be done. As far as CSR is concerned, so there I can say that we can ask them for the investment if they are interested, and they are already doing in terms of having equipment, newer technologies, introduction of the newer technologies, providing vaccine van. So that could be one part. I mean, it's very, I mean, so that is one area where we can help from CSR to invest into our system.
Thank you, sir. Thank you so much. Another question is from Mr. Amit Singh. He wants to know, as you are aware that malaria sickened to 24.1 crore people and killed roughly 6,27,000 in 2020. Finally, WHO has approved world's first malaria vaccine, GSK's Mosquirix. My question is there any plan to launch such vaccine in India?
So there are many vaccines are in pipeline. So I'm not here representing India, that I can say, but I must say that there are many vaccines which are approved by WHO, which are in pipeline, like SPV. SPV is already uh, has been introduced in Assam, Sikkim, I believe, Sikkim, and then typhoid vaccine, which was recently introduced in Nepal or Pakistan, and then again this malaria vaccine, which is extensively being introduced into the African countries. So burden is so it's all about priority. We generally in health system we see that where the requirement of that particular vaccine is more. So in that way, Africa is a place where the incidence and prevalence of this disease, the malaria, is too high. So right now, the global experts are deploying their effort there. But you are right, it may be introduced in India also, but it will take time because having a vaccine into the process is not a very easy thing. You have to go through many processes, many steps. Like maybe we have to conduct in-house, in-country trials. After that, it has to be approved. During COVID-19, it was an emergency situation. That's why we could have vaccine within a year. Otherwise, it takes at least 5 years to develop a vaccine, or you can say even to get approval for the vaccine. So obviously, it's always great to have a vaccine on board. But for malaria, I believe it will take some time. There are few more vaccines which are in pipeline, like SPV and typhoid.
Thank you, sir. So the next question is from Ms. Juhi Singh. She asks, uh, okay, temperature monitoring is not up to mark and AEFI reporting is also not there. What to do in such case and how to overcome this underreporting in AEFI case? Because giving vaccine is important, but at the same time, adverse effect too. We have enough reporting system, but not being followed. She mainly addresses about the underreporting, maybe reporting system is not being followed.
So I got the AFI part. So let me make it very clear. Nowadays, Government of India has invested a lot on AFI. There is a SafeVac app, web-based app where these cases are being reported. Even there is a column into the CoWIN app also where this could be reported. and it's being monitored very aggressively by Government of India. So if you want to see the data on the Government of India Ministry of Health website, even you can see the latest update also, that how many cases have been introduced into the system. I mean, reported into the system. It's being addressed at different level. Excuse me for a second. That is there. So there is no concern of AFI. Data is already available on Ministry of Health and Family Welfare, and capacity is being built of health staff to report. They are being the staff initially. The health staff was not comfortable because they were scared that if I report AFI, I will be blamed. But government took in the capacity was built in a way. Okay, you will not be blamed. And in investigation, you also divided into many components, like how what was the main reason for the AFI, whether it was because of vaccine component concern, whether there was any defect in vaccine, there was any problem into the vaccination process or cold chain mechanism. It's very strengthened in India. So there is no concern of AFI. What was the first part of this question? I missed that. I cannot hear you.
Sorry, sir. So the first part was the temperature monitoring is not up to mark, and AFI reporting is also not there.
No. Who is saying the government? That's the problem. I told you, na. That is the area. That is the thing which we need to do. Integration with the community, which I was discussing, which was asked by Dr. Dhananjay. The temperature monitoring in Government of India is best in world because we have EVIN. EVIN means, let me explain, let me tell you about the EVIN. EVIN has two functions. One is the most important thing. There are temperature loggers which are installed into the equipment, and which is a web-based tool or web-based equipment being operated with web-based tool, and you can see temperature of any equipment across the country, sitting in Delhi or anywhere. Obviously, not you, the authorized health officials. There is an alarm system also. If there will be any breach between the temperature, there is an alarm system. Message will go to the first to cold chain handler, then medical officer, then district immunization officer, then state immunization officer. There is a period 1 hour, 1 hour, 1 hour, and then to the national immunization officer also. And apart from that, there is a manual vaccine monitoring also. There is a logbook where all of the health workers are monitoring the vaccine temperature twice in a day. But obviously, how to ensure? For that, there is a supportive supervision mechanism. We have samples through which we can assess. Obviously, in few percentage, it would be always there. But at a chunk level, around 90% places, the vaccine monitoring is too good in India.
Thank you, sir.
Thank you, Parinita, for taking up the question. Sir, before you leave the meeting, I'd now request Ms. Chinelo Offomata to present a formal vote of thanks to you. She's a very dear friend to Public Health Buddies. She's our extended Public Health Buddy, and she's an alumni at the University of Leeds, UK. Thank you. Chinelo, over to you.
Greetings all, ladies and gentlemen. My name is Chinelo Offomata, and it's a great pleasure to be rendering this vote of thanks on the event of the World Immunization Week 2022, organized by the Public Health Bodies. First of all, I would especially like to thank you, Dr. Snehil, for taking out time from your busy schedule to share your inspirational thoughts and education to us, and especially for your patience in answering all our questions. Special appreciation to Dr. Lokesh and Dr. Himanshu for their insightful contributions. I would also like to point out a few key lessons that I personally have learned from this exposition, which is the importance of solar systems for low resource settings, to make the supply chain more independent and resilient, because where I come from is a big issue. So it's a key lesson that I've gathered from here. Then also, I would like to thank the attendees for accepting our invitation to be here today. And I hope that you've learned a thing or two from this webinar that would improve the work you do in vaccination programs, especially for COVID-19 and for other infectious diseases. Then finally, I would like to thank our host, Dr. Sunandita, for helping us to channel our questions to guest speakers. And I also like to thank everyone else who has worked behind the scenes to make this event a success. Thank you very much once again for your attention.
Thank you so much, Chinelo. And thank you, Dr. Snehil.
Thank you.
Thank you. Thank you, Snehil sir. Thank you, Lokesh sir. Thank you, everyone. It was such a pleasure to have you all. Thank
Thanks
you
to
so
all.
much.
Thanks, public health buddies
Everyone.
and Wainulu and then Parinita, Anjali and Dr. Sunanita. Thanks to all of you. Are really and Dr. Himanshu especially. It was very insightful. Actually, he raised very important points to be taken care. So thanks to all of you and thanks for having me here.
Pleasure,
All the
sir.
Thank
best.
you, sir. Thank you, sir.
See you.
Thank you. Bye, everyone.
Bye.
Thanks, Lokesh.